Next paper by Dr. Steinberger, expandable TLIF cages help achieve radiographic alignment goals, a comparison with LLIF.
Good morning. I'm Jeremy Steinberger, one of the spine fellows at a hospital for special surgery. Going to present on a study we're currently doing with expandable TLIF cages. The background, no funding or competing interests. Basically, it's not like a 100% consensus of the literature, but definitely there's a trend that the anterior and the lateral approaches provide a more robust and substantial increase in foraminal height, disc height, and segmental lordosis than TLIF. But no study has compared these variables with expandable TLIF cages only, comparing the expandable TLIF cage to lateral and anterior approaches. So our objective was really to focus on immediate radiographic outcomes in patients who are undergoing single-level expandable TLIF only versus those undergoing single-level LLIF at our center. I would say the reason we only focused on single level is because if we're measuring the increase in foraminal height, disc height, and segmental lordosis, if we were doing multi-level, it would have confounded the individual reaction to one-level surgery. So this was a retrospective review of 62 patients. 38 had expandable TLIFs and 24 had laterals. And we looked at radiographic and clinical outcomes. And the results, we found the ODI, VAS, SF12 PROMIS outcomes were not different. This is at 6-month follow-up. The average disc height increase with surgery was 2.9 with expandable TLIFs, 2.1 with the laterals, and there was no statistical difference between the groups. The expandable TLIF increase in vertical foraminal height was 11.6%, while that of lateral was 3.5%, but this was not a statistically significant difference. These are our results, and I wanted to focus on the percent change because we realized that if there was not a percent, there was definitely a difference in the levels of the TLIFs performed. The majority in the study of expandable TLIFs were done at 4.5, and the majority in the lateral population was done at L3-4. So we wanted to look at the percent change to show that there was a percent change more than an actual number, but we looked at both. To conclude, the decision on surgical approach is obviously multifactorial. When we looked at minimally invasive expandable TLIFs versus laterals, surgeons who favor the lateral approach cite better radiographic improvement, and while this has been shown to be true for static interbody cages, these results showed that for expandable TLIFs, the immediate improvement in disc height, foraminal height, and sagittal alignment is equivalent to lateral surgery. Thank you.